The prostate is a small gland. It's about the size of a walnut that sits just below the bladder, and its main role is to produce some of the fluids that carry sperm. So as men get older, the prostate naturally grows, and that can sometimes lead to problems with urination. So the most common problems and issues that we see with the prostate are benign prostate enlargement. That's a non-cancerous increase in the size of the prostate, and that can affect urination. There's also prostatitis, and that's an inflammation of the prostate or an infection of the prostate that can cause pain and urinary symptoms. Prostate cancer is another condition that we always want men to be aware of. So common symptoms can include changes in urination, such as needing to pass urine more often, especially at night, a weak flow, difficulty starting, or feeling like your bladder hasn't completely emptied. Some men may notice pain or blood in the urine or in the semen, but it is important to remember that early prostate cancer causes no symptoms at all. So early prostate cancer often grows really slowly, and it may develop in areas of the prostate that doesn't immediately affect urination. That's why relying on symptoms alone can be a bit misleading, and why awareness and conversations with your GP are so important. So risk increases with age, particularly from the age of around 50. On top of that, Afro-Caribbean men have a higher risk and may develop prostate cancer earlier. Having a father or brother with prostate cancer, so if there's a family history there as well, also increases your risk. There's certain genetic factors such as BRCA gene mutations which can play a role as well. And some people with Jewish ancestry may be at higher risk of that genetic mutation, which can increase the risk of prostate cancer as well. While we can't change age or genetics, maintaining a healthy lifestyle can help overall health. So keeping a healthy weight, exercising regularly, eating a balanced diet rich in fruit and veg and whole foods may reduce the cancer risk and support your general well-being as well. So the PSA test is a blood test that measures prostate-specific antigen. So higher levels can sometimes indicate prostate problems, including cancer. But in the UK, we don't have a national screening programme. But men over 50 or over 45, if they're at a higher risk, can request a PSA test after discussing the benefits and limitations with their GP. So it's important not to rely solely on the PSA test. PSA tests can sometimes be falsely elevated, so that means they could be elevated when you don't actually have cancer, or sometimes they can be falsely negative, so they can be negative even though there's a cancer present. So the other important part to the prostate test is that you get an appointment with your GP to discuss your symptoms, your risks, and then an examination can be conducted as well, which is a digital rectal examination. That means a finger into the back passage just to feel your prostate. Things we look for when we feel your prostate is whether it's enlarged and smooth, so enlarged or smooth, or we may feel whether it feels craggy. So the best way to describe it is feeling like an avocado skin. Those are the things that we look for, and it is vital that you don't rely just on a PSA test, and we have a full examination as well. That's why it's vital you speak with your GP to discuss your concerns and see what is the best options for you. So a raised PSA test doesn't necessarily mean it's cancer. Usually the next step is further assessment, often starting with a referral to urology, who will then maybe do a biopsy or an MRI. They may recommend further examinations of prostate tissue, which comes under the biopsy. So treatment depends on the stage and the risk of the cancer. Some men with low risk cancer may be monitored through active surveillance. Others may have treatments such as surgery to remove the prostate or radiotherapy, or they may have hormone therapy. So it all depends on the stage and the risk. If you have concerns, the first step is speaking to your GP. The NHS provides assessment and referral if needed, and organisations such as Prostate Cancer UK or the NHS website offer excellent information, helplines and support for men and their families.